In 2002, a remarkable story began that would highlight the critical intersection of global population health and political decisions. Jane Roberts, a concerned citizen from Redlands, discovered a shocking statistic in the UN Population Fund report. Nigeria had a fertility rate of over 7 children per woman. Fast forward to today, and those children have grown into young adults, many of whom are now struggling to survive in a country where food stampedes claim dozens of lives. This story takes an unexpected turn when we look at the political landscape of 2002. President George W. Bush had just vetoed a $34 million congressional appropriation for UNFPA, the United Nations Population Fund. In response, Jane Roberts didn't just sit idle. She founded 34 Million Friends of UNFPA, a grassroots movement that would become a powerful voice for global reproductive health. But here's where it gets interesting. Donald Trump, now the president-elect, was once on an honorary committee supporting UNFPA alongside Jane Roberts. The same organization he supported then could face significant budget cuts under his upcoming administration, especially with influential figures like Elon Musk potentially advocating for reduced funding. The impact of these decisions reaches far beyond political chambers. In Nigeria, the consequences of high fertility rates combined with limited resources have created a perfect storm. Recent news reports showed desperate scenes of people rushing for charitable food distributions, resulting in tragic stampedes. These aren't just statistics, they're real people, many of whom are the very children born during the period when Nigeria's fertility rate was at its peak. The UNFPA's work extends beyond just family planning. They provide essential maternal health services, work to prevent gender-based violence, and help communities build sustainable futures. Their programs have been crucial in helping countries like Nigeria address population challenges while respecting cultural values and human rights. Looking at the current situation, we can't help but see the direct line between past policy decisions and present-day consequences. The 7 children per woman statistic from 2002 wasn't just a number. It represented real families facing real challenges. Today, those challenges have evolved into humanitarian crises, as evidenced by the recent food stampedes. The story of UNFPA funding is a testament to how international aid decisions can have generational impacts. When Bush withheld that $34 million, it affected not just immediate services, but set in motion a chain of events that we're still seeing play out today. The organization's work in countries like Nigeria has been crucial in helping communities manage population growth while ensuring access to essential healthcare services. As we look to the future, the question remains, will history repeat itself? Will the new administration understand the long-term implications of cutting funding to organizations like UNFPA? The story of Jane Roberts and her 34 Million Friends campaign shows that individual voices can make a difference in global health policy, but it also reminds us that these decisions have real, lasting consequences for millions of people around the world. The connection between Trump's past support for UNFPA and his potential future decisions as president-elect creates an intriguing narrative about how political positions can evolve and what that means for global health initiatives. As we watch these events unfold, we're reminded that today's policy decisions will shape the lives of generations to come, just as the decisions from 2002 are impacting lives today.